Hello, everybody. How you guys doing today? This is Greg Graham. I am your host for Connecting the Dots, where we talk to different stroke survivors, brain trauma survivors, and also medical specialists to help connect the dots for aftercare when you leave the hospital. A lot of us, as a brain trauma survivor, feel kind of lost when we leave the hospital. There is not a lot of aid for us. So for the month of May in the United States, it's called Stroke Awareness Month. I have got different survivors and different medical professionals to help us out. So without further ado, let me introduce them to you. I have a recreational therapist out of Atlanta. Her name is Debbie Parrish. Hello, Debbie. How are you doing today?
Hi, good, thanks. How are you?
I am well. Thank you for joining us. Also, I have a stroke survivor. She's basically like my twin because she's an AVM survivor as well. Her name is Maddi Niebanck. How you doing, Maddi? She's from New Jersey, close to where I'm from, New York. How you doing?
I'm doing well. And you got my name right. Pronunciation. A lot of people can't pronounce the last name.
Yes, 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 yes. Well, I'm glad I did that. I didn't insult you. So let's get started with what we have today. Debbie,
Yeah.
recreational therapy, I heard of it before, but it's not that widely known in our community and it's not offered a lot. What is recreational therapy? Can you explain that to me, what that is about?
Yeah, great question. And quite honestly, most people have no idea what it is. Most people look at me and say, "Oh, sure. So you're physical therapy, right?" And I'm like, not really. So rec therapy actually is it's another therapy that we work in conjunction with the treatment team to accomplish the same goals for each patient, but we're hopefully doing it through the activities that each patient or client actually enjoys. So if you like to play cards, well, if you're trying to work on your balance or your endurance or anything like that, or reaching, depending on what everybody's working on, we can have you playing cards but standing up at a table and actually doing all of those things at the same time. Hopefully, we may actually introduce you to a newfound interest or a hobby or something else that you like to do. But that's basically what it is. But so we still try to improve your skills, overall health, emotional well-being, still having fun and getting back to your life with the newfound potential barriers that you may have.
So Maddi, let me ask you something. When I hear Debbie saying this, did you know about any of this stuff? And have you ever used recreational therapy?
So I feel like I was very fortunate in my, especially in like the inpatient setting. And when I first came into outpatient after having my stroke, I was exposed to very many different types of therapy. Of course, my physical, occupational, cognitive, speech, but then also things like art therapy, mirror therapy, just like my therapists were very good about trying new things with me and finding ways for me to get back to activities that I once used to do. Yeah.
So I'm so sorry, Maddi. What actually happened to you? Because you look like a very young person. And I know you probably get this a lot. It's like, you're a stroke survivor. What happened with you? Tell us your little story.
I am a stroke survivor. So real quick, I in May 2017, I had just graduated college and I went to Georgetown University. So I was down in DC. And a week after that, I had an elective brain surgery that I was going to get because I knew that I had an AVM in my right occipital lobe. And the reason that I knew about it was because I'd suffered migraines since I was 7 years old, like very debilitating, bad migraines. Found out I had this AVM. I said, great, I'm going to finish my education, graduate college, and then I'll do a brain surgery. And I had a job all lined up too, up in Boston for a couple months after. So I was like, perfect, I will get this surgery. I'll move up to Boston, to turn the next page, start a new chapter of my life. I went in for the surgery. It was at New York Presbyterian in New York City. And they had to do preoperative procedure, an embolization and an angiogram because my AVM was so big that they couldn't just operate on it. So they had to like kind of shrink it down a bit. But that procedure ended up causing a blood clot in my brain, which first, so I had to have an emergency brain surgery. I
I mean, I almost said it's kind of funny. Like, it's not funny, but literally my surgeon had just left to go home and get a good night's sleep before operating on me in the morning. And he like immediately gets called back, like, she's having a stroke. You have to do it now. Like, it's like not funny, but it kind of is. But yeah, anyway, so that's a little bit about me.
So Debbie, when you hear things like this, as you know, she just graduated college, she's a young person, do you see this a lot? And how do you are affected by it to actually bring them back to normal, like you said before?
It it hurts. I mean, because I hate that anybody has to go through anything like that. So it really does touch me. And I just want to help you guys, or whomever it is, get back to anything that you like. As far as, do I see that age frame a lot? Not necessarily with strokes, but possibly more so with car accidents and that type of thing, or falls. However, there are some, I mean, obviously it's not unheard of. So it just varies as far as the ages that we work with over at Pathways. It just varies. And as far as what I do to get back, I mean, I would talk to Maddi and I would say, I would give her my whole eval and find out what you like to do before everything happened. What are some newfound interests, that type of thing. If you even have any newfound interests, because I have this list of activities that I just say, hey, check off anything that you're interested in, whether it was previous or, yeah, that sounds kind of cool. And then we just kind of go from there. So, I mean, and I tell every single one of my clients, I say, if you don't like this activity, look at me and say, Debbie, I don't think so. I don't want to do that again. So I trust them and I want them for the feedback.
And
you
I'm glad you. Go ahead, Maddi.
I was going to ask, so you kind of build like your activities based off of what the interests of like the patient or your client is, and you come up with like what would be some examples of some activities that you might do?
Let's see. Well, it also depends on what they're working on, what they're trying to improve upon, what their skills are. So I have one client, I'll say I have had one client that is working on some visual scanning, and he has a young son.
Work on that.
Yeah. Has a young son. So I try, and he's active with his son. So I try to find activities that he could do or board games that he could do with his son. But yet we're practicing like even as simple as Uno, and you're trying to scan your cards that you have, or even Connect Four, because the vision could, depending on who it is, the vision could be pretty extreme. It just depends on what the deficits are. So, you know, I mean, we'll work on what this person may need to make a successful game, and he can play independently with his son. That's like one type of thing that I would possibly do. I've got another individual who loves gardening, loves it. I have 2 black thumbs. I kill everything that I do. So I tell her this, and I'm like, okay, let's make this happen. We've got some raised garden beds at Pathways. So I look at her, I was like, all right, we need some pretty things over here, but you're in charge. So let's make it happen. But you know, I take her to Pike's nursery. She picks out what she wants to do, and then she goes in there and she knows exactly. Her communication was a little off and needs assistance with that. So I write things down for her, and she's able to communicate that way. But at the same time, I show her all of the tools, all of the gardening tools, and she's like, oh yes, picks it up, and she's going to town right there. So it just depends on what everybody likes to do. And I definitely try to build the activities off of what their interests are. Absolutely.
I have a question for you, Debbie, and Maddi, please chime in after I ask this question to Debbie. To me, you know, the therapists that I had in my hospital, they're the reason why I'm this strong today. And I'm very, very happy to see you, not in your professional garbs or anything like that, but it looked like you're my friend, and you seem like you want to actually help me, and you're very comfortable, and that makes it very comfortable for us to open up to you, because you said something, you listen to your actual patient and you try to build off of that. That is the thing that I think we are missing when we go home. You know, we don't have a lot of people don't understand what's going on with us. And it seems like you, and you probably done this for about 20, 30 years, and you understand this logic and you're comfortable in your skin. So you're showing that to us and allowing us to become comfortable as well. You know, Maddi, is that something that for you, is it something that helped you get back because you had a good therapist that was very friendly and things like that? Is that important to you?
Definitely. I mean, I kind of mentioned this, but I feel very lucky that I got along very well with all my therapists, and they were very, like, I'm a very goal-oriented person, and my therapist is the same way. So he was motivated to help me by knowing what things were important to me, and we would like come up with goals that way. And that was very helpful. It was helpful to be kind of just aligned with my therapist, and we both want the same thing. And he would go above and beyond to come up with different things that might help me, which I really appreciated too.
So is that like one of the reasons why you got into this, Debbie? Because you're such a people's person and you're comfortable like that and you wanted to help people? Or was it just something you found out in career when you was like, you know what, career day, this is what I'm gonna do? Explain that.
Kind of fell into it. I really did. Growing up, my next door neighbor was an occupational therapist, and I did some volunteer work with her, specifically at hippotherapy with the horses. But when I went off to college, I was very much about me, and I didn't want to change schools, and my school did not have occupational therapy. So I was just like, I don't know what to do now. Okay. So I legitimately went to the career center and I just researched to see what else there was. And I happened upon rec therapy. So I knew that being with my neighbor who was an OT, I knew I kind of liked that aspect of stuff, but I didn't know exactly where my role was going to be. And so, yeah, I did. I fell into rec therapy, and I've worked in all different populations. My first job was working with kids with emotional and behavioral disabilities at an after-school program. And then I provided basically special rec therapy activities at a Parks and Recreation department for about 14 years. And then about 4 years ago, a little over 4 years ago, I fell into the Shepherd Center and now work with individuals that have had acquired or traumatic brain injuries. Yeah.
So I have a compound question with that, and I see Maddi chomping at the bit, wanting to say something. Hold on, Maddi, I got you. But my question I have for you is like, since you did have this love for it, you was influenced by occupational therapy, and you got into the, like, I guess the backdoor way you still deal with people. What do you tell caregivers how to actually deal with their patient once they leave your care? I think that's the most important thing, and a lot of times that is not done, or
Yeah,
it's just people just trying to get home and they forget about doing it. What is the most important thing that you want caregivers to know?
Depending on the patient, I typically, we have a day of family training. So I have the client here, and then I have whomever the caregiver is that's there. And I give caregiver a rundown of everything that we had been doing. And I try to give them as many resources in their community, or as many resources just to locate within their community. Even if I don't give them a specific location to try, just say, hey, you need to try the Parks and Recreation department in your community, the Chamber of Commerce, that type of thing, as far as finding activities, whatever may work out for that individual. But we try to, all of our disciplines, everybody on the treatment team, we all go through and basically train the caregiver on everything that we've done and how to continue on with having fun, if you will, as far as my side goes. As far as, having fun, as far as when they're at home, you need to do this. When you go out for an outing, make sure you have all of the supplies with you, if supplies are needed. Look for these things, look for those things. So we do try to, we have a packet that we give, definitely a packet with websites, with additional resources, with phone numbers that they can contact and ask us if they have any questions once they do get home, because it's a lot. They leave inpatient. I work at a post-acute location. So they leave inpatient and they come to me, and I give them a lot of the same information upon discharge. But at the same time, when they are leaving inpatient versus when they're leaving from me at post-acute, it's a world of difference, because they have progressed. So usually they have progressed so much that it just looks a lot different now than when it did when they
Right.
discharged from inpatient.
Right.
Yeah.
Maddi, did you have that same type of luxury when you left your hospital and left your rehab and you started being on your own? Did you have that type of luxury of, whoever your caregiver was, they got all this information, they was able to nurture you back to who you are today?
Um, I don't know about that, but I do have like a very strong support system, and I have a family and friends who will support me like if ever I need help. And although my big thing now is like I want to get to complete independence and I don't want to have help with anything. So that's
Absolutely.
kind of what I'm working towards and taking steps. I actually have a question for Debbie, if that's okay.
Go ahead, shoot.
Um, you were talking about occupational therapy earlier and how like you had that neighbor and you wanted to maybe go into it, but then your school didn't offer. I was wondering because I was thinking, and I have no idea, but it seems to me that there could be overlap between rec therapy and occupational therapy.
There
Good
could
question.
be. There could be. They do a lot more. OTs do a lot more, and I'm not going to get everything correct. So if there's an OT listening, I apologize if I get anything incorrect here. But as far as some of the activities go, yes, there can be some overlap, but they definitely do a lot more focus on the ADLs as far as grooming yourself and showering and bathing and feeding yourself. They definitely do a lot of those. Whereas I just want to get you to a restaurant and go out to eat, I want to get you back into the community and using those skills that you have learned with that OT to actually go back with your community and with your friends so you can do those fun things that you did before.
So like OT skills could definitely be applied in a rec therapy setting.
I almost think that there could be a little bit of skills from everybody. PT, OT, speech, everybody all in one. I personally, I do definitely work with the rest of my treatment team, PT, OT, and speech, to see what they're working on so I can do some activities to incorporate those skills and to continue to improve upon those skills.
Not you really making me think, and I thank you, Maddi, for actually bringing that question up. So now I'm in the hospital, and I know I'm a very charismatic person, and it seems like whoever I talk to becomes my friend instantly. So maybe they thought I didn't need recreational therapy because I can communicate and I can actually go back into society normally. So what is that litmus test that they actually have at the hospital that you go with your team and say, okay, this person needs this, that, another, they don't need recreational therapy. What is that litmus test and why? And I get it. I know you probably don't know the answer to that, but why does it get skipped over a lot?
So I can only speak for Shepherd Center. I can't speak for any of the other hospitals or facilities.
Yeah, absolutely.
But I can say that pretty much everybody at Shepherd Center receives rec therapy. Depending if they enter at a certain level where they are not responsive, then they may not receive it until they are responsive and they can actually tolerate it. So that's going to be more of the medical side of things where the medical say, the doctors say, no, not yet, not yet, not yet. Okay, now you can go on in because they are responding a bit more to various tasks. When they come to pathways, for me, which is where I am, that we have two programs. We have the day program, which is where they get all the therapies, PT, OT, speech, and rec. So anybody in day program definitely receives rec therapy. And then we have outpatient, which is basically single service. So if you only need to have PT and speech, then you get those couple of therapies. However, there are some individuals that come to outpatient that do want to have rec therapy. They may request it, or to find some new leisure interests, or because they want to be independent, like you said, Maddi, as more independent in the community or whatever it could be for them. Or their therapist may just say, hey, they're telling me that they just go home and sit on the couch all day. They need to do something different. So can you reach out to them? They have all of these goals that they enjoyed before having a stroke or whatever it could have been. Maybe you can reach out to them and figure out how they can incorporate it into their new life.
Copy. So Maddi, with you saying you want to be more independent, what are the type of things that you want to be more independent you think that Debbie can help you out with?
Well, I have a ton of goals, to be honest, but
That's awesome.
my
Awesome.
they all tie into my desire to be like independent. And I have a goal that I'm living at home with my parents right now. My goal is to move out within a couple of months. I don't know what would be for me. I think one of the biggest holdups is the spatial awareness and loss of vision piece. So for me, I think the hardest thing, even more so than like learning how to walk or trying to use my hand, has been like adjusting to I can't see everything anymore. And like I don't really have any peripheral vision. So I'm always needing to turn my head. And like that's been something that has been a huge adjustment and is still an adjustment. And just, I don't know, I think for me it's the awareness is the hardest thing.
Yeah.
The neglect and all that fun stuff.
Yeah. But you already know how to compensate for it, and you can adjust and you can make those adjustments to enhance the vision.
Yeah, I just have to remember to do it.
Okay.
And that's a great point that you said, Maddi. And I really want you to dive into this, Debbie, because I don't have vision impairments, but I have insecurities, and it's basically almost similar to what Maddi's having. I'm a big guy. I'm 6'4", 250 pounds, and I want to walk with my daughters down the street and feel like I can protect them, but I really can't. I think more of it is mental issues that we have, or mental blocks that we have these anxieties that really hold us back to doing the next stage of our life. Because I was in the same position as Maddi. I had to go back to live with my mother. Then I got my first apartment that I ever had in my life, and now I'm trying to adjust with that. But I had to take that leap of faith on my own. Is that a potential roadblock for you? And how do you actually deal with that roadblock if it is that insecurity?
As far as me?
Us. How you deal with it for us, training us?
I try to talk to you about, I would use you as I'm going to use you as an example. So
use me.
You said that you have the insecurities that you want to be able to take a walk with your daughters. So I would take you on multiple walks, on multiple community outings, and I would say, pretend like I'm your daughter. I may correct you at different times, and maybe like if you had the visual deficits like Maddi mentioned for scanning, I may try to say, hey, encourage you to don't forget to scan that direction. Don't forget to look all the way behind you when you need to do it before you cross that street or before you cross that driveway, for anything like that. But at the same time, I'm going to just try to hold a regular conversation with you as we're taking these walks, which these are definitely things that I do at work. I try to incorporate what exactly your life may look like at home and who you live with and what you definitely want to do. Walk down the street and be able to protect your daughters. Get back closer to living on your own, and not live with mom and dad anymore. So we would definitely do some of those activities to encourage the independence and to encourage and get you more comfortable out walking around in the community, that type of thing.
You know what? Go ahead, please.
Do you mind? I just thought of something. If the goal of Rec Therapy is to get people to be doing back to the things that they enjoy, like say walking down the street with their family or whatever, at what point do you know that someone, like, you get discharged from Rec Therapy, or like, is it okay once you're able to walk down the street, then we don't need it anymore? Or
not necessarily. It's a case by case basis, honestly. I have had some outpatients that's all they wanted to do. So as soon as we finished that, as soon as we accomplished that and felt comfortable with that, and everybody on the team felt that way, then yes, maybe they would discharge from Rec Therapy. However, my individuals that are on the day program that I see every single day, we'll come up with another goal to hopefully accomplish. So I personally don't think that anybody really discharges officially from Rec Therapy. I think it's one of those that continues on when you leave the hospital or when you leave your outpatient facility. You're at home and you're continuing with exercises at home. You like myself today, I went for a walk and for a run today with my friend. So I mean, that was rec therapy for me. I'm jamming to some music and singing at the top of my lungs. That's another form of rec therapy or stress reliever. So I don't know. I think everybody still continues on with rec therapy, just in different aspects and in different ways, even when they're not at the hospital.
Debbie, have you ever heard of this, like dog therapy? I had this person come up to me online and was like, Greg, do you want a dog to be your companion? We'll give it to you for free and your insurance will cover it. I'm like, never heard of this. What is that all about? Have you ever heard of anything like that?
Animal assisted therapy. It
Okay.
is one of my favorites. I love it. We do have a facility dog at Pathways. And in fact, Shepherd Center has a number of dogs. I can't remember the exact number, but a number of dogs throughout the hospital. I know I should know this, and I'm told like every week, but I can't remember. 6 or 7, maybe. Sorry. But we have one at Pathways, and he's one of my favorites. His name is Barboza. He's part of Canine Companion for Independence, or so CCI. But things that we do and how we incorporate Barboza into our therapies is his owner is always with us because his owner is also an employee at the hospital for exercise physiology. But she's always there because she knows Barboza's commands and that type of thing. So if we have an individual that needs to work on speech or memory, we may teach them some commands, or we may teach them some facts about Barboza and then try to have them recall those commands, maybe write them down and then erase them and have them remember what they were. If we have individuals that need to work on one of their upper extremities, or they're working on endurance while for standing, we may have Barboza on a table or on a mat and have the individual standing up, working on the endurance or balance. And then we may assist with their arms for their upper extremity for grooming or brushing Barboza, which is just, I mean, number one, you're with an adorable dog, so how can it go wrong? But at the same time, it's if they are already a dog person, then it's amazing, and it's got such a great connection, and it's just it's truly amazing to see how a dog affects an individual's emotion in an immediate way.
The energy.
Yeah.
I get that.
So I highly recommend animal assisted therapy. Absolutely.
So are they just companions, or they will be able to help out? Like, for instance, Maddi, when she has the deficit for her vision, or are they like guiding dogs as well, or is it just companionship?
There are guide dogs that can help with vision. That's going to be a different area that I'm not 100% familiar with, but I know they are out there. I know there's a guide dog foundation. Exactly which one is the best or what all of them are, I'm not 100% sure, but I know they exist out there, and there's others that can just be companions. There are some that can help out with when individuals start to have seizures. There's a number of ways to have a dog to help you out. Absolutely.
Okay. What do you think about that, Maddi? Is that something that you're interested in? Because I'm thinking about it myself, because I'm bored as heck up in here, and I would love a companion right now and have a dog that's around here.
I would like one too. It's hard because I feel like my schedule is so busy right now, but I do like a dog. We used to have a dog, my family, like growing up, and then she died, and we haven't gotten another one, and I really miss having a companion.
Yeah.
I have
Sorry.
No, go, Debbie. Go.
I was just gonna, for anybody, there's just something about coming home and having this dog greet you with just a hello, how are you? How was your day? And then they just cuddle with you and snuggle with you. But there's just something wonderful about that for everybody.
When I was in the hospital in Kentucky. That's where I had my stroke. And I had no family there, but there was this volunteer that used to come around with her dog and put the dog right in our laps. I couldn't move or anything like that, but it's just, I felt the energy.
Yeah.
There was something cosmic about it that I can't explain, and it helped me get stronger.
Yeah.
I completely agree with that.
Amazing.
I'm really thinking about getting a dog now to actually be my companion, because I am
I
bored,
think you should do it.
especially
Do it.
because of COVID. So no, so I got a question with COVID. With COVID and all these restrictions, how are you actually dealing with your patients? Is it easier, harder? Now everything's on Zoom or whatever type of meeting video platform. Is it making it easier for you to connect with your people and motivate them through the camera?
As far as my therapy goes, we're not through telehealth. So pretty much everybody that I see is in person. But we have specific protocols and procedures that we have to either wear or do or use in order to continue on with the precautions for COVID, definitely. Things have opened up a little bit more recently. So for a while there, it was really difficult. We were very limited at what we could do, but I mean, my coworkers and I, we got as creative as possible to do what we needed to do and how to accomplish what we wanted to accomplish with our clients. But since it's opened up a lot more now, we're actually able to do more activities at the tables, more groups, but not a lot of people groups. We're still trying to keep our distance and that type of thing. We're still fully masked and we have goggles and all that fun stuff. But we can also go on outings now. So we can take individuals to Target, to Publix, to Home Depot, different things like that. We still make distance from other customers, but we're still trying to get them back out into the community or go to the park. The park is a huge place because we're lucky that we have a park right across the street from us. So we go there, number one, just to get in the fresh air, get out in the community, and just out of the four walls of the building that you're at every day for therapy. It's
Right.
great to see something else. And then we can work on so many different things when we're out there. So with COVID, it was a struggle at first, but it is opening up a little bit more, little by little.
Now, well, your stroke happened in 2017, so it really not applicable to you. But was you actually still trying to go through therapy during COVID, and how was it for you, Maddi?
Sorry, to me.
Yeah.
So I was basically 3 to 5 days a week, intense therapy for a year and a half. And then I was discharged. And then since then I've gone in like little bouts of therapy. I'll go back for PT and OT. So my most recent one was actually, it was in the fall of this past year. And then I don't know, I'm hoping that I'll go back at some point for either OT or PT this year, but I'll have to see how my schedule allows.
Copy. Well, ladies, we're getting close to our time, and I'd like to open up the floor and see if any of our audience members want to ask any questions to us. You can ask either you, Maddi, or either you, Debbie. Ladies, I see you there. Hello, ladies. How you doing today? Yeah, give me those beautiful smiles. I love it. Do you have any questions for Debbie, or do you have any questions for Maddi? All right, they're just looking, nodding. That's no. But I do have one question. I have a friend here. His name is Duncan Kemplin, and he asked me a question. He was actually a person that had locked-in syndrome, and he came out of it. So, but he's still in his wheelchair, and he's still trying to come full circle. So Duncan has asked me, and I guess it's both of you guys can answer this question. He's asking me, since COVID is lifting up, what are activities that you are interested in? You gotta remember, because Duncan, he loves to see people just shining and doing things, because that's his goal. So lighten up his day, ladies, please. Maddi, go first.
So I have so many goals, Duncan. Let's see. I've been doing more traveling since things with COVID have kind of opened up a little bit more. I actually went quite recently to the British Virgin Islands, and I traveled there all by myself, which was amazing. So that was like a huge goal of mine. More independent travel. And I got there all by myself to meet my friend, which was amazing. I went swimming in the ocean for the first time since my stroke when I was there, which was also huge. But yeah, I would love to start doing more independent travels. And like I mentioned, living independently is another big one.
Cool. Debbie?
Yeah.
So for my goals during COVID, my
No,
activity,
after when it's getting lifted, when everything's, I guess, back to normal, what do you want to do?
oh, I want to see the world. I want to travel the
Yeah.
world because just like
Yeah.
everybody else, I had vacations planned last year that were squashed. And quite honestly, I haven't seen my dad since well, 2019. So I will be visiting my dad. I just want to travel. Yeah, I really want to travel. Big, huge.
Well, Duncan, I hope you can hear us. And once you get better, like I said, you and I are going to Jamaica. We're going to have some fishing festival and some red stripe beer. So you better get ready for it, bro.
Don't forget me. I'm coming too.
We all come.
Hi,
Get yours on
Duncan.
it. Everybody's welcome. I don't care. Let's go have a party.
Nice.
But before we close this out, ladies, I want you to basically tell us a little bit about whatever things that you're passionate about, whatever thing that you want to actually share with us, the audience. Debbie, if you have any websites that you want to give people about recreational therapy or canine therapy, things like that. Maddi, anything that you are passionate about that you want to give to people, feel free. Debbie, I'm gonna allow you to go first.
Anything that I'm personally passionate about?
For
Well,
recreational therapy.
okay, that's a long question. Okay. The main thing is I just want people to be able to do what they want to do. I mean, honestly, I do. No matter what it is, I want them to do what they're comfortable with doing. And I just don't want them, as I tell all my clients, I don't want them just to go home, sit on the couch and eat bonbons. One or
Right.
two bonbons are great, but not the whole thing at one time. But I just want them to get out there and live their life, whatever it may be.
Yes.
As far as websites go, you can always visit shepherdcenter.org and you can go follow on there, go to the departments and then recreation therapy, and you can see a whole lot of different activities that we potentially do. COVID, within COVID, but also there could be some activities that you may be interested in doing as well. So maybe there are some wellness clinics that you guys could join in on, that type of thing, but just go on there and see what's going on.
Cool. Maddi?
Well, I'm sure, as you know, Greg, like I'm very passionate about connecting with the stroke and brain injury community. So encourage anyone to reach out to me. Instagram, I'm pretty active on there, sharing just not random, like my recovery and things that I'm doing in my life, whatever. That's been great. Yeah, great way to reach me, to connect. What else? I like to write. I've written some books, so check those out if you're interested. I always keep, I'm up in my room right now and I always keep one copy with me. This is my second book and most recent one. Yeah, now you can see it. It's called Fast Forward, the Fully Recovered Mindset. It's about my my stroke recovery journey the first 3 years.
Nice.
Where can we
Congratulations.
find that?
Thank
Where
you.
can we find it? Where can we find it?
It's on Amazon. Fast Forward, abbreviated FWD. Fast Forward, the Fully Recovered Mindset. And yeah, that's about it, I think.
Cool.
Nice.
Well, I thank you ladies so much for coming on. I thank you, Debbie from Atlanta, from the Shepherd Center, for allowing you to come on here and giving us all this information and taking your time out to help out these stroke survivors and brain trauma survivors. I really appreciate you doing this for us. And Maddi, I thank you for coming out here and taking a busy, I know you have a busy schedule. You're a young, what are you, a millennial or what is it, Generation Y? You know, you're a young person and you want to do all this stuff. Is it Z now? I don't know.
Oh my
I'm
God.
old. I don't know what they are, but I know you have a busy schedule and I really appreciate you coming out to talk with us. You know, guys, this is the second week of Stroke Awareness Month, and this is our third episode. We have 2 other episodes. If you want to check them out, go to AVM Superhero on Instagram, on YouTube, and also on Instagram is AVM_YouTube. And I have a link inside of my bio that you can check out those actual videos. The first one was vocational therapy, and the second one was occupational therapy. So we have a lot more coming up for this month. So please tune in, and thank you guys so much for listening. Love you guys. AVM Superhero out.
Thank you, Debbie.
Thank you guys.